Hey, we're back with my in-studio guest, Governor Eddie Calvo, and the folks want to talk to you, Governor. Let's go to Frank from Chalampago. Frank, good evening.
Good evening, Governor.
Hey, Frank, how are you doing?
All right. It's good to talk to a cola man.
I've been drinking more coffee lately.
Anyway, I know you're doing your best to come across something to solve that issue, the cola, but I wanted to call in and maybe you can, to remind you about that bill that you signed into law that authorizes $20 million to be borrowed to resolve it. And it's already a law. So is there any way that that can be revisited by your team to go out now since we're borrowing for everything else? Maybe we can get that COLA done and get the Madam Cool what they need.
Frank.
Okay, thank you, Frank.
Thank you. And again, good comment. Frank, this is something I've been trying to move forward and resolve this issue. I mean, every day there's one of these retirees that passes on without resolution. And there was recent legislation that was enacted and dealing with again, these notes. And unfortunately, nothing panned out.
My understanding is that nobody responded.
Nobody responded. One of the things we're doing again is I'm trying to find ways through a revenue anticipation bond to pay off our tax refunds. And these are 3 years that are past due. What I'd like to do is do some calculations and see whether it may be possible to include the COLA settlement as well.
And so maybe paying it down, even if...
and even we can pay down a large percentage. I think we're looking at between $17 and $20 million is a balance left. And this is something I've told our fiscal policy team.
It just incurred interest again April 30th. Yeah, so it might be a little more than that now.
And this is an obligation. These are things that we need to pay off. And again, this is what has happened over the years. We have a $349 million deficit. A lot of this are obligations such as tax refunds or COLA that are owed to people. And it's important that we pay off these obligations and move forward from there. We do believe with the supplemental budget and the biannual budget that we have some very conservative revenue figures and that we've identified enough resources to at least keep our services stable.
Let's go to Margaret from Delano. Margaret, thank you.
Gentlemen, good evening, Governor.
Good evening.
The reason why I'm calling was that I was confined at the hospital last week. And I was totally, disappointed. Is that the room that I was given in, the sliding door, whatever you call where the drape is, it is so dirty you cannot see the beautiful scenery of Tuman. And not only that, the cabinets where you're supposed to put your belongings was broken. And the protocol is that you usually have the nurse to check you in on whatever you have, coming in, what you're bringing into the hospital and whatnot. My linen wasn't changed. The only time I think they changed it was, I guess, when I was at the OR. While going to the OR, sir, I have to, they have a blanket to cover me, and I have to put something over my nose to cover the smell, because originally I was stated to be put on the OR 7:45, but then it was changed to 1:45 in the afternoon. So I don't know whether the OR people just finished eating, but I just can't stand the smell. And not only that, it's moldy. As you go in and you see the ceiling there, it's dirty, sir. So I don't know what's being done, and from understanding on the news that there's Medicare that is coming here to check on the hospital. And I think that's the first thing should be done. I understand that your lieutenant governor is also on a beautification task. Why can that place be water blast? Because there's mildew and everything, sir. When you come into a hospital, you expect it to be treated like the hotels because you're paying for it. I have a dual insurance, and I have more than my share to pay the hospital. and I am disappointed. Thank you.
Thank you very much, Margaret.
Again, thank you so much for your sentiments, Margaret. Margaret, one of the first areas that I had concerns is coming in as governor is what I saw is a lack of the quality of health care and also in terms of the operations, the financial condition of the hospital. And I had to make some very, very drastic changes there, both the board and the management. They've been able to really make some major improvements in terms of operational savings, in terms of stabilizing the finances of the hospital over these past few months. But these are issues that are so important. It all goes down to critical patient care. I'm glad you brought this issue up. This is something that I will, again, with my special assistant in the governor's office directly communicating with the hospital board and management. I will bring this up with the hospital to see what we can do to resolve these issues. It's been a good news this week. We just opened up the ribbon cutting for the Southern Regional Community Health Center. Much of that financing came as a result of when I was Ways and Means Chair of the passing of the tobacco bond. And again, working with Linda DeNorsi and some of the federal agencies and partners in building that facility. We just had the expansion of the VA clinic, or the opening of the VA clinic here in Guam. I've just sent over to the federal government a report on what our requirements are as a result of this military buildup, and we're looking at multi-million dollars request for support in the expansion of our hospital and of course new facilities. There's a new private hospital that is opening up as well. I do believe that Guam has to look to the future and not, number one, not settle for mediocrity. That's right. But settle also for top quality. That's and this is a commitment by my administration. So again, I thank you for your concerns, Mark, and we are really going to work hard to see what we can do to work with the board and management.
Let's go to Barbara from Chalampago. Barbara, good evening.
Good evening, Governor.
Good evening, Barbara.
Thank you for what you're doing, following up the school. I have seen you going around visiting the school like what you should do. It is good. I give praise to you. Thank you for that. But there's one thing I would like you to help us. Us retirees, like myself, I really need a health insurance that I can afford to pay. Right now, I am on that 2,000 deductible, and I will never meet that. The renewal of the insurance is coming up again, and I will never meet that. Every time I have to pick up my medicine, I have to pay it out of pocket. Like to have my blood test, my doctor's visit out of my pocket, and I'm retired. I'm receiving only very little. I took that early out. So can
Barbara, thank you very much. I appreciate. Let's get
Barbara, you're a GovGuam retiree.
Yes.
Yes, I am Government of Guam Retirees, DOE.
I know the RFP went out, I think today. Well, I think this is important as there's negotiations start occurring. You have to start looking at the ability to pay, and there were some issues that were brought forward in the past, and these are questions. There was a Cadillac plan that was put out. I think that there has to be options available for GovGuam workers and retirees. What I'm hoping to see is again more interest from other companies in regards to providing health care for GovGuam workers and retirees. And then, of course, the negotiating team working with the legislative side as well to ensure that we have a plan that is affordable to not only to the government, but to also workers and retirees. And I think it has to be very transparent as well. So we don't get into the situation we got into as in this past year.
You got it. Hey, we'll come back. More with the governor when we return.